Okay, welcome once again. Today I'll be discussing about uh, the continuation class of the hearing loss. In the previous class, you have the faculty have the sort of probably discussed about the type of hearing loss. In the simple classification would be, in case of hearing loss, would be a conductive type of hearing loss, sensorineural hearing loss, and the mixed type, where both the conductive component and the sensorineural component would be present there. And today I'll be discussing about the sensorineural type of the hearing loss. As you know, in the terminology, there is a sensorineural term is there. It is a component. Actually there is a two component. There is a sensory part and there is a neural part. And please recapitulate the normal anatomy of the ear. In case of conductive, the outer ear and the middle ear will be mostly involved. In case of sensorineural, then the remaining part, especially the cochlea, is usually involved in case of sensory, and in case of neural, the cochlear nerve and the sensorineural component of the including the brain stem, where all the sound and all the are modified or integrated there in the brain. So we'll be discussing about the today, as we are discussing about the hearing loss, in day-to-day life, hearing or what we communicate or what we hear or what we discuss during learning or during our work or during meeting or listening music or any kind of sound. And due to that, we easily communicate with other, we express our views, we express our emotions. These are very important to our day-to-day activities and our, as we say, the life. But when some kind of problem arises in case of hearing status, the patient will feel some kind of stress or work activity will be decreased. In case of children, the burden will be more than the adult one. And as we cannot communicate with other persons, there will be a personal relations will be handled. Let's discuss about the size of the problem. Why the sensorineural hearing loss is so important for us. For a reference, I'll be mentioning about the WHO. In 2005, in the whole worldwide, about 278 million people had this hearing impairment, and it was involved in the 20 leading cause of the disease or the impairment for the global burden. Means the majority of financial loss was there due to the hearing impairment. But these are the data which are easily diagnosed, or where the physicians or where the health facilities are there and the data are taken, and these are taken by the WHO. But recently, the WHO has also published some kind of data. Now, the same program has increased. About the 466 million people are involved in some kind of hearing loss. It might be a mild, it might be moderate or severe. Among them, the 34 million of them are the children. And these, especially these are the most targeted uh, patients for the hearing loss. It is estimated that about 2050, this will be developed about 900 million. And they have mentioned the different causes of for the hearing loss: genetic, complex birth, drugs, noise, or aging. But among them, the 60% of, in case of children, are the preventable causes. Means we can manage that kind of cases, or we can detect early, so that in the future for the children, development and the patient's language and the person development will be not hampered. And please note that about 1.1 billion of young people, ranging from 12 to 25 years of, are risk of hearing loss due to the exposure to the noise in the recreation settings. Means it may be a discotheque, it may be due to the loud noise of music system, concerts, earphone, regular use of earphone, where usually the young persons are attracted to that. They might have some kind of a hearing loss, may be there. And so WHO has mentioned that to prevent, identify, and addressing the hearing loss will be cost effective, and it won't be a burden to the family, persons, even a society, even a state. So these are one of the impairment of the people. The hearing loss will be one of the disabling cause for the patients. Why the sensorineural hearing loss important? It might be for individuals, especially in case of children, prelingual children. Prelingual children means the children, those who has not developed a speech at around 1.5 year or 2 years, 2 to 3 years, the patient or the children especially develops their speech, they learn and they try to speak. At that time, when there is a problem of hearing impairment, there will be a profound effect. There, the speech will not develop as we expected. The language, the skill development, because the children they learn their by hearing or by seeing or doing the work repeatedly, and when the children can hear, they can develop the language, speech, and communication to be hampered. And even when they go to school, the progress will be improved. They get failed, they will be harassed, and they don't have a negative effect, psychological effect, and they avoid the classroom. And for the adult, they will be difficulty in keeping and performing in case of occupations. For example, let's say for a teacher or the person who works in a bank, some other teller or a cashier, if he or she has a problem of hearing, but there will be lots of problem. The people will hear the wrong words, wrong amount for teachers. The questions will be not heard and cannot teach, and there will be some kind of psychological stress will be there. So the people might uh, leave the job or something like that. So there will be a social isolation and stigma. The people, other people who can hear better will isolate the patients, isolate the people, and they try to avoid. So there will be a social stigma is there. And for the state and for the family, there is loss of productivity. If one of the children has a severe hearing loss, one of the parents should be there to handle the patient. So the production, if they would have been a work in the both work in the office, but there will be a less production or their income will be less, the financial loss will be there and leading to the other problems will be there. And there will be, by repeatedly going for the treatment will cause a social and economic burden for the patients or even the hospitals or the state or the society. So it might have a profound effect in case of hearing loss. So let's go to for the causes hearing loss. It can be divided into simply congenital and acquired. In congenital, genetic, syndromic, non-syndromic, just I'll be discussing about the important part of the hearing loss, and other part will be discussed in the receptive classes when there is a discussion about the how to examine a children with a hearing loss or adult with a hearing loss. Congenital and acquired. Congenital will give divided into genetic and further to syndromic and non-syndromic, and non-genetic will be also be a causes of hearing loss, sensorineural hearing loss. Okay. Congenital, the hereditary like sensorineural, the most common or most specified are Waardenburg's, Usher's, Pendred, Alport syndrome. These are the few genetic or congenital causes of hearing loss, and non-syndromic might be autosomal dominant, X-linked, or autosomal recessive type of hearing loss. Congenital non-genetic would be aplasia of the cochlea with the different cases like nasal mondini type of dysplasia. The viral species, the mumps and measles may also be the causes of sensorineural loss, ototoxicity trauma. In case of acquired labyrinthitis, ototoxicity, trauma to inner ear, noise-induced hearing loss, idiopathic sensorineural hearing loss are one of the most discussed and common and preventable or some kind of manageable kind of acquired causes of sensorineural hearing loss. Other less common causes would be perinatal asphyxia, connectors, and supraorditis media entering acoustic neuroma. There might be a case of sensorineural noise would be there in case of presbyacusis is the one of the commonest causes of sensorineural hearing loss among the all mentioned causes. Presbyacusis is the also known as the age-related hearing loss. We'll be discussing the later slides. And acquired might be any less causes would be vascular lesion in a rare or systemic problem like renal failure, diabetes. Again, the systemic viral infections like mumps, measles, meningitis, encephalitis, or ear problem like a perineal fistula. And will be a few important causes of sensorineural hearing loss might be a case of ototoxicity. We'll be discussing now. Oto means ear, and toxicity means, as you know, the toxic effect of the drugs. So the simple division I have mentioned is the tendency of certain therapeutic agents to cause the functional impairment of inner ear as a side effect of pharmacotherapy. Or just you can mention that these are the unwanted. You use medications for treating some kind of diseases, lesions, but due to its side effect, the effect would be in the inner ear. So that will cause ototoxicity leading to some kind of hearing loss. It might be a topical irrigation, inhalation, drops, sprays, or system like intramuscular or intravenous. These are the few drugs or chemicals that may cause hearing loss. Aminoglycosides, they are the high risk and which may cause a permanent damage. Cytotoxic, especially cytotoxic means they are anti-neoplastic drug. They, especially the cisplatin, are very much named for the high risk for the permanent damage of the inner ear. Industrial chemicals like toluene, epinephrine, macrolides, loop diuretics, like in case of furosemide, salicylates, Quinine Derivatives, and others like barbiturate, beta blockers, muscle relaxants are the few causes, few drugs that may cause the ototoxicity. The aminoglycosides are the most common drugs that we use into day-to-day life, especially in the children. Streptomycins is for the ATT, for the anti-tubercular therapy. It is include the kanamycin, gentamicins, amikacin, tobramycins, or all type of aminoglycosides are used for the as a antimicrobial agents, but and still commonly used day to day, that it had effect in the outer hair cells of the organ or body, and outer hair cells are the more vulnerable than the inner hair cells, and they are responsible for the hearing, perception of the hearing. But not all the patients that are injected have a ototoxic, which is dose, duration, and other comorbid conditions might have a effect for the further damage of the inner ear. As you mentioned, in ototoxicity, aminoglycosides is the number one. Then cytotoxic agents, cisplatin. As we in the case they are given in case of chemotherapy for the head and neck squamous cell carcinoma. About 50% of patients have some kind of ototoxicity, and leading to the loss of outer hair cells. Again, cytotoxic agents also targets the outer hair cells. Diuretics, furosemide is usually used in dental lab. In the trade name, it is as a Lasix. Lasix, commonly mentioned, furosemide or furosemide. This will cause the reversible reduction of the endocochlear potentials. There is a electrical change in the inner fluid, and there is some changes in the extravascularis. So that might lead to the hearing loss. Some industrial chemicals like toluene, which are used in printing and the wood finishing, benzene in plastic injury, they are also listed in the case of hearing loss, but the conclusive evidence for the evidence is still unknown. Vancomycins, in case of antibiotics, polypeptide antibiotics, they are usually ototoxic when given at the higher doses for a longer period of time. So, any patients who are treated with these types of drugs or antibiotics should be pre-operative prior to the medications. It is ideal to advise them go for the audiogram, and after the treatment, so repeat for the audiogram whether or not the ototoxicity had developed or not. Macrolides, erythromycin, azithromycin, clarithromycin might have a ototoxicity, but it might be a transient one due to the reduction in the transient evoked ototoxic emissions. It might be a transient one, but it may also case, but they are the least causes for the ototoxicity. Salicylates, which are used as anti-inflammatory, antipyretic, anti-platelet, and analgesics. And they are ototoxic in the higher doses. When given in the higher doses for the long period of time, it might causes the ototoxicity. Quinine derivatives, antimalarial is used as the antimalarial. They are also high risk for development of ototoxicity. How does the ototoxic patients present? Tinnitus might be a first symptom. There is a high tone of hearing loss is there. The patient might have a vertigo or any kind of disequilibrium, and also epilepsy might be there in case of aminoglycosides. And the patient won't be able to focus on distant object, and when try to focus, there is the object. The patient perceives the object is jumping and not focus at the center point. So once the ototoxicity develops, in case of aminoglycosides, cytotoxic drugs, it might be a permanent. We cannot get back to the normal, but it would be a better to have a prevention. Is better than cure. So, as far as possible, it is wise to avoid the ototoxic agents. If given, should be monitored, and early recognition should be there. Cessation of treatment and the substitution of agent if you suspect for the ototoxicity. For the permanent, hearing aid is the choice for the rehabilitation of the sensorineural hearing loss. Tinnitus, if mild, nothing to worry, but if the patients feel disturbed, tinnitus marker or in case of hypnotic drugs might be even and for the particle distributor, physiotherapy and the bacterial rehabilitation exercise are well tolerated. Presbyacusis. Another causes of sensorineural healers is a presbyacusis. These are the most common. It is nowadays it is termed as a age-related sensorineural hearing loss. Means when you get the human being gets old, especially after 40, there is some kind of changes there. There is a wrinkles. Then the people might develop cataract. The hearing, the sight power will be decreased. The hair will be turned into gray. Yes. In the same pattern, there is some kind of hearing impairment may develop in case of human being. Everyone who crosses 40 might have some kind of hearing impairment be there. And so it is termed nowadays as the age-related hearing loss. It is inevitable, means the body changes or the nature, we cannot interfere with the nature. And especially, as I mentioned, the 40, usually the 6 decades, crossing the 6 decades are the mostly more vulnerable for the age-related problem. And there might be other external factor might be there, for the environmental factors might be there for the deterioration of the hearing loss in case of presbyacusis, like noise exposure, alcoholism, smoking, high blood pressure, blood hyperviscosity. This might be a additional causes for the deterioration of the hearing loss in case of presbyacusis. सबै उमेरको मान्छेले एकै तरिकाले नसुन्छ, एउटै उमेरको नसुन्छ. So additional problem भयो भने they might have a more hearing loss might be there. So what happens in case of presbyacusis, age-related hearing loss? In histopathology, there is a sensory hair degeneration and the hair cell degeneration and loss. In case of neuron, there is a degeneration of neurons and the ganglions. Metabolically, degeneration of stereovascularis and degeneration of supporting cells and membranes. Once hearing hair cells, main part of the hair cells, neurons, ganglions, stereovascularis, supporting cells are sub degeneration or loss. So that might be lead to the presbyacusis. How does the patient present? There is some kind of hearing loss is there. The patient speaks slow and insidious, and the patient, there is a lack of clarity, and some might say there is a loss of volume. Sunchu tara buzdina. Chalko volume. If we raise the volume of the voice, the patients, the patient say, not to shout, I'm not to deaf. हजुरआमाहरुले देखिरहेछ चल्को बोले किन कराएको भन्छ. That might be a problem. Tinnitus might be there, or it might be initial symptoms for the presbyacusis. So simply speak patients in the slow, clearly articulated voice. Close to the patient ear. The patient might hear better, and having it for the sound amplifications. The simple management, and we in the future classes we also discuss about how to manage the hearing loss patient in children and adult. So just the superficial discussions only there in the today's class. And another causes of hearing loss is the noise-induced hearing loss, which is more common nowadays. due to the interstitializations, as you mentioned, that there is a recursion settings which will causes some kind of problem there. There is a noise-induced hearing loss. There is a reduction in the auditory acuity associated with noise exposure. It might be social, recreational, or the occupational. It might be divided into temporal threshold shift and permanent threshold shift and acoustic trauma. Acoustic trauma means there is a single loud exposure is there with the intense trauma leading to immediate hearing loss. कानको छेउमा बम ब्लास्ट भयो भने तपाईलाई acoustic trauma त्यसरी भन्न सक्छ. But noise induced hearing loss चाहिँ slowly it might causes a hearing loss. In case of temporal threshold shift, it is a reversible and the hearing loss is only for the few hours or 2 days. But in case of permanent, it is irreversible and it's permanent hearing loss is there. There are few for hearing loss. In case of it might be a okay. Let's continue. Regarding the pathophysiology, metabolic changes, stool changes are mentioned as a case of hypothesis. Like in case of temporary, there might be excessive glutamate release and there is a cochlear hypoxia. And in case permanent, there is a depolarization of active filaments in the cilia and swelling of striovascularis. And now it is and supporting cells where there is a necrosis. Few predisposing factor for the noise-induced hearing loss. Genetic might be a causes. Smoking, diabetes, ototoxicity, cardiovascular disease, and tinnitus might be a first symptom. And there is a high-tone hearing loss is there with the north center as a 4,000. 4,000 by deep punja. There is a 4,000 Hz ma, there is a deep. This is a typical for the noise-induced hearing loss. In the previous class, in the case of ototoxicity, you have seen there is a 2,000 deep for the ototoxicity. In case of noise-induced hearing loss, there is a deep in the 4,000 Hz. This is typical for the noise-induced hearing loss. So, how to manage? Prevention is better than cure. As you all know, there should be awareness and regular provision is there. In case of ILO, it is mentioned that any person who works in a noise producing area should not be posted for more than 8 hours per day of any and should be evaluated for the hearing loss at least a year, once a year, or any problem should be rehabilitated or transferred to the other area to prevent the further damage. So there should be awareness and legal provision is there. And the person who working in the noise generating area should have a protection. So noise protection should be there, and there should be at least reduction of noise level at the place of work as far as possible, and using the protective devices. Not more than 8 hours, not and 5 days a week. So there should be a protection for the not to develop the noise-induced hearing loss. And another component for the sensorineural hearing loss is the idiopathic sensorineural hearing loss, or sometimes we mention as a sudden sensorineural hearing loss. And this is one of the important topic. There might be a short case for the case of idiopathic hearing loss or the sudden sensorineural hearing loss. It is simply defined, or there are the 3 components for the definition of this sudden sensorineural hearing loss. There should be a 30 decibel or more sensorineural hearing loss. at least in 3 consecutive frequencies, occurring in less than 3 days or 72 hours. भनेको 3 दिनभित्र अथवा 72 आवर्स भित्र देखा परेको हुनुपर्छ एउटा। अनि अडियोग्राम गर्दाखेरि 3 consecutive frequencies मा hearing loss हुनुपर्छ। Especially these are also high frequency hearing loss. 2000, 3000, 4000 लगातार हुनुपर्छ। 3000, 4000, 6000, 5000 मा त्यसै लगातारै frequencies should be involved, and at least 30 decibel or more essential hearing loss should be there for the to identify as a idiopathic sudden sensory hearing loss. But this terminology or sudden sensory hearing loss is the diagnosis of exclusion. All the known or unknown causes of sensory hearing loss are excluded, and then only we can term this sudden sensory hearing loss. It is taken as medical emergency. So there should be a investigations. The history should be taken meticulously. Examination audiogram should be there as soon as possible, and some kind of radio imaging might be a good help for the management. What causes the sudden sensory hearing loss? Still, the definite causes is unknown, but mostly accepted hypotheses pointed to the virus. Herpes simplex virus is taken as a for the sudden sensory hearing loss, because most of the cases are preceded by the upper respiratory infections. Other causes postulated are vascular, hematological, membrane rupture, or autoimmune are also postulated for the sudden sensory hearing loss. Audiogram is the must. So, and with the history and with the audiogram, and the patient should be treated as soon as possible. Sometimes the patient should be admitted for the IV injections. Many agents have been tried for the treatment of this kind of sensory hearing loss. Steroids, antivirals, vasodilators, antioxidants, carbogens, vitamins. But our institute, our guidelines are directed to intravenous or oral hydrocortisone or steroids, including hydrocortisones or dexamethasones in hydrogels, and gradually tempering to 2 weeks or more than 2 weeks, according to the patient conditions. But in case the patient have a comorbid conditions, we might have to adjust according to the patient's conditions. But we prefer steroids. What happens to the patients after developing the sudden sensory hearing loss? If the patient comes to the ENT doctor within 72 hours, there is high chance of remission is there. About 75% in some institute or in some articles. Complete recovery might be there if there is only the slight hearing loss developed. Partial recovery in case of 50%, and 50% might not have the complete recovery, even though we wait for more than 6 months or more. So, regarding the prognosis, there is a variety of prognosis. There are few predisposing factors which might causes the development, which might hamper or which might changes the prognosis status. Especially tinnitus, vertigo, is the patient who has a comorbid conditions like diabetes, hypertension are not good for the remissions or for the recovery of the hearing loss. But if the patient have the mild hearing loss, does not have other, they are young, if they do not have other medical conditions, they might have a good chance of recovery. But comorbid conditions, old age, complete hearing loss during the presentations are not favorable for the recovery. And other hearing loss causes a sensory hearing loss, non-organic hearing loss, like they are especially there is a non-organic means the known causes or suspected causes of other organic causes is absent. In case of hysterical or malingering means, in case of recruits or prisoners, they assume or they just act that they cannot hear. And there is a total loss. This is a medical legal causes. जसले गर्दा मेडिकल इस्यु आउँछ र सम काइन्ड अफ फेभर कन्डिसन आउँछ भनेर पेसेन्टहरुले विशेष गरेर मेरो कान सुन्दैन अब झगडा भएको बेलामा त्यस्तै someone steps and claim that I cannot hear my hearing loss, there is a total hearing loss after the step managing the medical case, medical legal case हुन्छ पुलिस केस भनेर सुरु गर्न सक्छ सो त्यस्तो कजहरुमा पनि यो आउँछ सो they should be evaluated by the ENT surgeons. So to rule out the actually there is a organic cause or just a malingering or some kind of historical causes. During the examinations and the history taking, there is a disproportionate and inconsistent hearing test results. एउटा टेस्ट रिपिट गरे भने भिन्दै भिन्दै रिजल्ट आउन सक्छ झुकाउँछ so if there is a true kind of hearing loss is there might be a result will be the same if we repeat it time to time but in case of malingering एकचोटी राम्रो सुन्छ एकचोटी कम सुन्छ उले झुकाउँदाखेरि त्यस्तो हुन सक्छ यो विशेष गरेर अर्को रिकर्ड भन्यो अर्को मेडिकल पुलिस केसको लागि भन्यो र कसैलाई इन्स्योरेन्सको माने क्लेम गर्नको लागि नि केसहरु आउँछ सो वी डू सम काइन्ड अफ tuning for test like standard tuning test and audiogram is the most audiogram way and trigonometry like for the stereo reflex and some kind of bera गर्नु सकिन्छ र जसले गर्दा non organic cause of hearing loss can be established. So some cases of hearing loss might be due to the trauma, like fracture of temporal bone. In case of temporal and transverse type, there might be a sudden sensory hearing loss due to the injury to the aortic capsule. In labyrinthine contusion, due to the head injury with keys of due to the chemical labyrinthitis, and during the surgery, damage to the oval window labyrinth might cause a hearing loss, iatrogenic. Okay, this was for now today, and this is one of the sensorineural hearing loss is one of the important topic for the theory as well as the viva. Please go through this, and will be discussing about the other type of hearing loss with the respective diseases in the coming weeks. And thank you for today. Let's see you soon.